All right, so for our posture workshop, one of the things that has recently come about is this idea that sitting is the new smoking. And they, I think it was the New York Times, I believe, that put out this article that said sitting is the new smoking. And what was interesting about this, and this was actually several years ago, like 5 to 7 years ago, and we know that these numbers are actually worse now, but it is worse for you to be somebody who is sitting chronically throughout the day than it is to be somebody who smokes and works for UPS. I mean, think about that as far as your body's concerned, like lifting and moving and pushing and pulling. That's way better for you than it is to be at a desk job. And smoking, I'm not suggesting you take up smoking by any means, but it's worse for you health-wise, both physically and for your heart and circulation and just overall health to be a sitter than it is to be a smoker. So just to kind of give you an idea of the degree of dangers there are with sitting. And it's funny, I have people all the time that look at this and they're like, okay, it's posture. Is it really going to kill me? Well, I challenge you to do this. So what I want you to do right now is to slouch.
That's easy.
So as you're slouching, try taking a deep breath. Okay.
No, challenging.
Come up to just a regular position and now breathe in. You see a difference there?
Mm-hmm.
So if you imagine that, let's say you get a little germ, and I usually say, think of pneumonia, but now we start thinking about COVID too. But imagine you get a little germ that gets into your lungs and it starts to fester and you get this, what we'd think of as pneumonia, where you've got an infection in the lungs. And they can give you breathing treatments and they can give you antibiotics and you can try to get to that actual infection, but it's covered in mucus and it's hard to get to. One of the best ways to help get that out is to be able to to do a big cough. And imagine, go ahead and slouch again. How big of a cough can you get here? Like it's just up in your upper lungs versus when you're upright, you can actually move the air and whatever else to work it out of your lungs. So a lot of times people say, well, posture can't kill you. Well, I'll tell you, I've worked in almost every setting a physical therapist can work in. And especially when you look at hospitals, nursing homes, long-term care facilities, when you see somebody who comes in with pneumonia and then they put them in a bed and they fold them over, you know, the beds instead of flat, they lift them up, they put a pillow behind their head, and you see this person who's basically folded over into a little ball, guess what? How good do you think that person is able to, like, how functional is their breathing?
Mm-hmm.
Probably not. They're all squished over. So when people ask, does posture really matter? Or they say, it can't kill me, I beg to differ. If you're not able to put your body in a position for it to function normally, then things are going to start to go wrong. Now, we talk about the drastic thing when we look at pneumonia, but the same thing with your heart function. If you're slouched over, you've closed the space around your heart and you have less room for the heart to get its full pumping action. If you're squashed over, your intestines and your organs are squashed down, they're going to be they're not going to work to their optimum potential. So we tend to, from my perspective, I'm usually working with people in pain, back pain, neck pain, shoulder pain, heel pain, ankle pain, night cramps, Bell's palsy, Parkinson's. We're working with people, they either have pain or dysfunction, something that keeps them from moving the way that they'd like to. Mm-hmm. But it goes so far beyond just the things that I see. Posture has to do with everything in your body, basically. So when we look at, if your posture isn't great, then it can cause a lot of problems. So if you think about this, poor posture can lead to pain in the obvious areas, your spine. But people don't always think of if the poor posture is affecting their neck, their shoulders, their head, as far as headaches, problems through their arms, back, hips, knees, ankles, even your feet and big toes are going to be affected by your posture. And people say, well, I'm not always in the bad posture. Sometimes I have good posture. Well, you have to look at, what are you spending more of your time doing? Are you spending more of your time in that bad posture? Well, I don't know if your mom ever said this to you when you were little, but mine did. She said, if you cross your eyes too long, they'll get stuck that way. And I'll tell you, I've never actually seen it happen to eyeballs, but I've seen it happen to every single other body part. If you leave a body part in a position long enough, it'll start to get stuck that way. And I see this happen where I have someone who will like kind of have a bad posture, and then they stand up and what do they look like?
Mm-hmm.
And they
Yeah.
wonder if they can't stand up straight. Well, they've probably been hanging out in a lazy boy or a couch for hours at a time in the evening, binge watching something, or and this happens a lot faster than you'd realize. And it only takes like one part of this to go wrong before the whole thing seems to kind of come crashing down. And I have a lot of people who will tell me, Alaina, I was really fit and healthy, and then I had this one little injury, and then it felt like my whole body just got old. And
Oh.
old doesn't happen overnight. So usually it has to do with these positions that your body's in throughout the day. Now, and if you're chronically putting your body in those positions, your body has to accommodate. And generally, instead of like normal breathing, you'll end up doing this number.
Real shallow.
Everything from how you breathe to how your heart can function. And one of the things I want you to think about, if your head weighs as much as a bowling ball, if I'm holding a bowling ball like way out here in front of me, it feels a lot heavier than if I keep it close to my center of gravity.
Mm-hmm.
Well, if I'm leaned over forward, that means I'm halfway to falling. Okay, so your fall risk with bad posture goes way up. And we know that with falls come risks of fractures and other injuries that can often be devastating. It's funny, like when I was a kid, I was like, what's everyone so scared about falling for? Guess what? Now that I'm farther from the ground, it's a little more scary than when I was a kid. And I don't bounce like I used to.
Right.
So, yeah, and even death. Dun, dun, dun. That sounds scary, doesn't it? So I've given this talk to so many different groups, and it's interesting when I'm speaking with people who are like, it's kind of, there's this mid-range, and then there's people who are over 55 and people who are under 30. And the under 30 crowd doesn't really seem to connect with the death part. Because it seems like such a foreign concept. They're not as worried about falls and their heart and lung function, but I'll tell you what they do worry about. Profile pictures on Facebook.
I know.
So I usually tell someone, imagine if someone took a picture of you from the side. Would it be here or would it look like this? And nobody would just look for if someone were to catch a picture of them. So if I can't appeal to your sense of, health and wellness, at least we can try to appeal to your sense of, you don't want to have bad pictures that will forever be on the internet.
Mm-hmm.
So just a few things I want you to start thinking about there. Hi, I'm Alaina. That's my dog, Murphy. He's sticking his little tongue out there.
Murphy. Cute.
A lot of people are like, well, who are you to be telling us all about posture? Well, to give you a little bit of background, you're not going to find too many therapists in the area that are better credentialed. I've gotten 4 manual therapy certifications. I'm almost done with my 2nd doctorate. And I teach over for South College. I have a 5-year fellowship in orthopedics and manual therapy, and I'm a board certified orthopedic specialist. So really all that means is that I've gotten a lot of exposure to a lot of cool ways to fix these things. And really I look at all of this, and people ask me what I do. I really look at this little part over here on the right hand side where it says I'm a body mechanic. Like that's more of what I do. I work with bodies. So body mechanic, and I hang out with my dogs. But how I came to specialize in spine and posture correction, speaking about posture is one of my passions because it ties in with so many things. When I'm treating a shoulder patient, if their posture is bad, their shoulder's in a bad position. And we can treat it till the cows come home. But if I don't address the actual cause, like if I don't fix the posture as well, they're just going to end up with the same problem. People with headaches, if they're down in this position and they wonder why they get a kink in the neck, guess what? I can't move that head until I fix the posture and the rest of it settles down. Low back pain, hip pain, problems with the ribs. I have some people who even get nervy things out into the arms or legs, and those are going to come down to what is their posture doing? And the posture of your trunk has so much to do with your digestion, your breathing, your swallowing, how you think, how you focus. Are you getting enough oxygen into the rest of your body? And these are things that people tend to not think about, but they go hand in hand with a lot of the problems that we have. And also, the cool thing is the more I've learned about this amazing machine that is the human body, your posture doesn't have to be perfect. It just has to be not bad, if that makes sense. So we're going to teach you how to do that today. So some of the most common causes of poor posture. All right. I guess I could have set this up a little bit better. Some of the most common causes of poor posture are going to be one of these things. There's your dog again. But a cell phone. How many times do you see someone like this? Right?
Right.
Well, again, if your head weighs about as much as a small bowling ball and it's sticking out forward all the time, people come to me and they're like, Alaina, I have all these knots in my muscles right here. I'm so tight in this area. Well, why? I'm leaning forward. Now the whole weight of my arm is hanging on those muscles, pulling on my neck. It creates all these other problems just from, it doesn't seem like it's that big of a deal. It's just a little cell phone, but your body curls all the way around it. And I know some kids who will do this for hours and hours at a time, to the point where I'm treating children with neck injuries now. To the goodness, I saw a 9-year-old about 3 weeks ago that had a terrible disc bulge in her neck, a 9-year-old, because she was spending so much time on the couch on her cell phone. One of the other things I see that can really contribute to posture is driving. And there's this idea that bucket seats in cars, you know, they're kind of like this, where the bum is here and the knees go up and the feet go out. People tend to think that this is a comfortable position in a car, and it feels a little bit like a lazy boy chair. And you get in, you're like, this is so comfortable. And in reality, what's it doing? I'm not sure. I'll come over this way a little bit so I can back up and you can see better. So they do this. I'm doing activities that tend to pull me forward with my arms forward, my head forward. That can contribute to some of the problems. And finally, regular activities. People think of this in terms of how do you get through your day? Do you sit at a desk to get on the computer or to do some work or balance your checkbook or go shopping? Are you on a couch? Do you watch TV? Do you sit at a kitchen table to do things? A lot of times people eat their meal and then they'll hang out there for a while. You know, all these funky positions, you know, visiting with people, which is fine. But these are all things that people tend to do that put them into bad postures that we don't think about. Your car, your cell phone, and your job. The 3 things that you do the most are probably the 3 things that are killing us.
Yeah.
So at this point, well, what can I do about it? So we're going to teach you today about how to use your spine. And this may seem a little interesting. People kind of roll their eyes at me sometimes, but let's see here. Lesson number 1, bones are hard. So, skinny is a spine. I know it's a little bit kind of hard to see all of them here. Something on skinny here. White stuff on here. The white stuff is bone, and bone is hard. Most people look at me like, really, Alaina? That's rocket science. Like, the reason that matters is in your body, the bones are the load-bearing support structure, okay? Just like in a building, you want the weight to go through the support beams of the building, not through the drywall. Well, in the body, you want the weight to go through the bones, not the muscles, ligaments, tendons, nerves, skin, hair, fascia, eyeballs, organs, all these other tissues of your body that have a function, but that function is not to hold up the weight of your body. So there's this idea, and if you think, you know, anyone who's ever been in the military, my husband was a Marine, and he'll get that big posture that they do. And I thought, buddy, you're just working too hard. Because good posture is not about holding your chest up and sticking your chest out or pulling your shoulders back or sitting up tall. If everyone say like, pretend you're just being pulled up high. That's just a lot of hard work. And guess what happens after a couple minutes or when Sister Agnes isn't watching? We drop right. So a lot of people have this idea that good posture is this hard, difficult thing. The reality is good posture is not about holding it up and sticking them out. It's about putting the least amount of stress through the fewest amount of structures and still being able to do your day-to-day activities. So I want you to think of your spine like a little stack of blocks. Okay? Well, I'll put a little table here. So if we look at this stack of blocks, all right, you notice it's not perfect. It's not a perfect stack. But if the bottom block is on the level, meaning it's on a level surface, or the bottom block is where it's supposed to be, you know what I just realized? I could probably do this. Can you see that a little better?
Yeah, thank you.
So if we think of this stack of blocks, you notice it's not perfectly stacked. It's kind of a little janky in some places, but are these blocks working hard to stay stacked?
No, they look, yeah.
They're just resting there. Gravity allows each block to rest on the block beneath it. So if the bottom block is level, the rest of the blocks can just stack. Same thing in your body. If we can find a way to get the pelvis, the bottom block of your spine, to be in a good position, the rest of the blocks the rest of the way up will just stack. Now, if one of the blocks is janky and starts to tilt, eventually something's got to give. Either the blocks fall, or some of the muscles on the backside are having to get really tight to keep those blocks from falling over. So what happens in people who kind of are hunchbacked or tipped over, to keep those blocks from falling, you have so many different muscles that kick in to try to help. And in reality, it feels like you've got tight muscles. And I can't tell you how many people I know that will come in, they try to stretch their neck, do all this stretching because the muscles are tight. And in reality, the better question is, why are those muscles tight? Your muscles don't just wake up one day and say, let's be mean. They're doing a response to something. And if you keep doing the thing that made those muscles tight to begin with, guess what? No amount of stretching is going to make a difference. It'll just keep coming back. And this is where people struggle over time, because they try to do what feels like it's going to help. And in actuality, it will help if you stop doing the thing that's hurting you. Does that make sense?
Yes, perfect.
So, lesson 2. That was graceful. Lesson 2, it's just a stack of blocks. Okay. Now, the third thing we want to look at, let me pull up that screen again. Okay, so next things that we look at. So it's just a stack of blocks. When we look at a spine, oh, here we go. When we look at a spine, I'm going to put this kind of close.
Okay.
You know, at the bones, in between them, there's a little disc. That disc, people tend to think it's like a shock absorber, but in reality, it's a spacer. So if you look at the spine from the side, this is the pokey part that you can feel in the back if you reach your hand behind your back. But we've got the bone and the disc, and right behind it is this little guy. It's a nerve. That nerve comes off of the spinal cord, and it sends messages. So your brain sends a message down the spinal cord. It goes out the nerve down to your body to tell it, hey, kick this ball or squeeze 10 pounds. And then let's say a bug lands on your hand, and that sensation is going to go back through the nerves, through the nerve root, up the spinal cord to your brain. So it's part of that information highway of your body. So this is the part that can get really angry sometime. I don't know if you've ever heard of a pinched nerve, but as you age, the disc will start to flatten out, which means you'll start to lose some of the space around that nerve. And when you lose that space around the nerve, that's called stenosis. So those are some things that can be issues as well. If you think of it, it's just a stack of blocks. A lot of people get really nervous about a spine. They think it's really complicated. It can be. But as far as you need to think of it, it's just a stack of blocks. All right. So when we think of that stack of blocks, do you remember I said if we can get the bottom block to be level, the rest of them can stack?
Mm-hmm.
Let's look at that bottom block. All right. This is the pelvis. It's the bottom block before these blocks go up the spine.
Mm-hmm.
Have you ever had a little kid sit on your lap and they have those obnoxiously bony little butt bones?
Uh-huh.
You still have them. Mine are not as bony as they used to be. But if you look on the pelvis, on the bottom of the pelvis, right under here, those are those bony butt bones. Okay? And then right here,
All the sit bones.
the sit
Sit.
bone or
Uh-huh.
the ischial tuberosities.
Ah.
Whatever we call them, they're on the bottom. So what we look at is if we can find a way to set that bottom block, the pelvis, so the most amount of weight possible is going through those sits bones or through those bony butt bones. When we find a position, the most amount of weight is going through the bones, then we've unloaded as much stress from those other tissues that we spoke about.
Mm-hmm.
So again, the idea is good posture isn't about being super straight and having good looking perfect. It's about finding the position that puts the least amount of stress through the fewest amount of structures and still allows you to do your day-to-day activities. Does that make sense?
Mm-hmm.
Perfect. Now, let's go over how to use the bony butt bones. And most people look at me like, what? And I say, well, learn how to sit. And they give me another look like, I'm sitting now. I think I know how to do this. Well, we're going to go over some strategies for this. And I'll try to set this so you can see. Let's make this a big screen again, shall we?
Okay.
I'm sitting, and I'm not sure if you can see, but I got my feet on the ground.
Mm-hmm.
Posture, it's not this, but
Mm-hmm.
it's also this. It's hard, doesn't it?
Mm-hmm.
I'm going to find the position where I can rest. The way I do that is I'm going to take my hands, slide them down the side seam of my shirt, reaching around under my bottom, okay? And I'm going to feel for those bony butt bones, okay?
Mm-hmm.
Let my belly out and slouch down.
Mm-hmm.
The pelvis back and forth. I'll notice if I sit super tall, I'm holding more of my thigh. And as I slouch, I'm holding more of buns of steel.
Mm-hmm.
Not super tall, not super slouched. In that middle zone, I want to find that spot where the butt bones are the boniest and the heaviest. So when I find that bony spot, I'm going to take my hands out and I'm going to let the weight of my head stack through the blocks of my neck, blocks of my back, and just rest. So if you notice, how's my posture? Not perfect, not terrible. It's kind of boring, isn't it?
So
So
comfortable.
that's all we're looking for. If I can just stack it, I can rest that way. And I'll tell you, I do this for a living. I look at posture, talk about posture, fix posture, teach about posture, 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 posture. And I don't have time all day long to be thinking about my posture. It's just not functional. So instead, we take the lazy way, kind of like a crock pot. We're just going to set it and forget it. Okay? So how's that feel? It's just there. It's not particularly hard. It's a little different. Now we're going to go over some strategies that are going to make this easier or harder. So what I want you to notice is where your feet are. I'm so afraid this is going to snap shut. Here we go. Okay. So right now, my legs are basically level. All right. If my knees are higher than my hips, do you see how that automatically folds me over forward?
Mm-hmm.
If your knees are lower than that looks a little better, doesn't it?
Mm-hmm.
Lower it allows me to use this thing we call a butt. And underneath your bum, there's a little shelf. I like to call it your butt shelf. So if you can rest on the shelf, it's much easier than trying to roll around and find those spots. And I'll tell you, that's much easier if your knees are a little lower than the hips. Now, a lot of people like to did a desk job and gave you a handout and said, this is proper sitting posture. And they have people sitting with their knees 90 degrees, 90 degrees, 90 degrees. And that's really not functional for more than a few minutes. So if you can find a way to set your posture where you can rest, and if you don't have a chair that goes up and down, you can simply take one foot and drop it down. Put that foot underneath your seat.
Mm-hmm.
Rest in that comfortable position. Now you notice I didn't talk about the back of a chair, did I?
Mm-mm.
So if I lean back into a chair, is the weight of my head resting through the blocks of my spine, or is it hanging on all these muscles?
Mm-hmm.
Yeah. So I want you to start thinking about the position you're sitting in. Everyone says, oh, well, I'm too short, or I'm too tall. Everyone has an excuse, or I have to sit with my back all the way to the back so I have support. In reality, these blocks, they don't get supported from the side. They get supported by having a level bottom and everything else just stacked.
Mm-hmm.
It might be a little different than what you've thought of for posture in the past. So that's why we like to go over it.
Okay.
Any questions so far?
No, not really.
Okay, excellent. So we'll just keep on trucking along. All right. So now that you know about great posture, guess what? It's not going to work. Even good posture in sitting is still sitting. And you remember the first thing we said?
Yeah.
Sitting, smoking. We don't want to be sitting. So it doesn't mean that you can't ever sit, but you've got to do it in moderation. I want you to think of sitting as spine chocolate cake. Standing, walking, moving, that's spine broccoli. How does your diet look? Is it more spine chocolate cake or is it more spine broccoli?
I've been doing a lot of sitting here last few months.
Yes, especially with COVID going on and people being at home,
Mm-hmm.
it puts a wrench in things a little bit. So instead of beating yourself up about sitting, I want you to be aware that it's okay to sit sometimes. You just don't want to sit for a long amount of time, okay? If you are sitting for about 15 minutes, then you have to do one thing every 15 minutes. Unsit.
Okay.
And then you bought yourself some more time. It's literally as simple as stand up, and then you've bought 15 more minutes. So that took me, what, 2 seconds to stand up and sit down?
Mm-hmm.
You have a job in an 8-hour day where you're supposed to sit the whole time. If you just stand up and sit down for 2 seconds every 15 minutes in an 8-hour day, that's only 64 seconds of your day.
Not much.
64 seconds. People are like, oh, I'm so busy, I'm so busy. It's 64 seconds. That's 1 minute. And you'll be so much more productive in those other 59 or all the other time there that it's worth it to just stand up. Now, a lot of people don't realize there's an art to standing up. So I could get up this way. I see a lot of people that get up like this.
Right. Mm-hmm.
It takes them a moment to be able to stand up the right way or even get all the way upright. When you look down as you stand up, you put the strain on your back and your shoulders and your neck. And really your legs aren't doing anything but being a pivot point for you to swing your momentum over. However, the secret to helping take care of your spine and body was to have a perkier bum. And the way to do that is by doing 50 squats every day. Most people are like, oh, I don't know if I have time for that. So instead of thinking, I'm going to do 50 squats every day, think about this. How many times a day do you stand up and sit down? Up and down from your bed, up and down from the toilet, up and down from the breakfast table, up and down from the toilet, up and down from the car seat, up and down from a couch, up and down from a desk, up and down from the toilet seat, up and down from lunch, up and down. You're up and down for different reasons throughout your day. Even if it's just taking every 15 minutes, that little stand up and sit back down. It doesn't take that much. If every time you stand up, you look up, maybe to like a clock or something on the wall. If every time I stand up, I look up, essentially, I'm doing a squat. That didn't look too bad, did it?
Mm-mm.
A lot of people tell me, Alaina, I have bad knees. I have back problems. I have to use my arms. I have to do all these things. And to begin with, it's a little bit tough. It takes 2 weeks of working on this every time you stand up and sit down for it to get much easier, for you to get more efficient at using the muscles you've already gotten, and to start having a better quality of safety and breathing function. So let me show you the best way to do this. A lot of times people are sitting way back in a seat. There. Are you able to see me from there?
Yes.
I'm sitting way back here, and I try to get up. Leaning forward. That's not really a good job done, is it?
Yeah.
And so what I want to do is 3 things. First, I scoot up to the edge of my seat. Second, get my feet back under my bum. Third, I look up as I stand up. Okay? When I sit down, the important part is that I back up so that I feel the chair behind both legs. If both legs don't feel a chair, both legs won't land on a chair. So I still look up and I stick my booty out the back as I slowly sit back down. That
Right. Look up to sit up. I like that.
So, step 1, go ahead and give this a try. I'm going to talk you through it. I want you to sit up to the edge of your seat. All right. Now get your feet scooted back underneath your bottom. And then look up to stand up.
Okay. Yeah.
Now back up. Make sure you can feel the chair on both legs. Then you stick your booty out the back as you slowly sit back down.
Yeah. I didn't sit down slowly, so.
A lot of people struggle with that.
Yeah.
Now, how did that feel?
Felt pretty good. I just need to practice it. I think it's a good solution.
Yeah. So it takes a little bit of practice, but with some practice, you'll get there.
Mm-hmm.
Okay. Any questions on anything so far?
No.
All right. So all of those things that I told you can come about from bad posture, breathing problems, circulation and heart problems, digestive issues, problems with your organs being kind of squashed from the bad posture, pain in the back, neck, shoulders, head, hips, knees, ankles, feet, all of those things can be pretty uncomfortable. So a lot of times people say, well, I'm not sure if my posture can ever be good, or I'm not really good at this yet. And they'll ask me, so is there any way that I can get relief? Well, there's a really easy way to answer that. I'll tell you, I'm a physical therapist. I've been doing this for over 15 years, and I found there's one easy way to tell if someone's going to benefit from conservative care without medications, injections, or surgery. And that's, is your pain reproducible? Do you have something or a certain time of day, or is there something that happens that when you do this activity, it increases your discomfort? Because if your pain is reproducible, guess what? It's reducible.
Mm-hmm.
Just a little play on words for the day.
I like that.
If your pain is reproducible, it is likely reducible. Now, if your pain is reproducible because there's a bone sticking out of your leg, guess what? That's why we have emergency rooms for. There are some things that are more serious that are reproducible, and we would end up sending you back to the doctor for those. But 90% of the things that cause people musculoskeletal pain, if there is a specific direction of discomfort that you have, it hurts if I sit too long. It hurts when I pick up my grandbabies. It hurts when I'm walking around the grocery store. I have to lean over on the cart to keep from my back and legs hurting. It hurts when I sit too long, stand too long, walk too long, lift a heavy box. If you have activities that reproduce your discomfort, we should be able to reduce your discomfort. So people ask me, again, people don't think of posture as something that's like, oh, I need help, my posture is off, as much as they think of, oh, I threw my back out, I can't walk, or I can't, my shoulder hurts, I can't care for my child. Posture is not one of those things that just is there and grabs you and you have to do something about it right away. It's more like high blood pressure. It catches up to you over time until the bad stuff happens. So people ask me, so when do I really actually have to get help? Well, guess what? You're already taking the first step by joining in a posture workshop. And we've gone over how to find that neutral posture position. If that posture position is uncomfortable, usually that means you have some restriction somewhere in the spine that's limiting you from getting to a comfortable, neutral position. So if you're not able to get into that position and be comfortable, that's the time you need to get help for your posture. Something to think about. In the last 30 days, how bad was your discomfort? If 0 was no pain and 10 was being mauled by a bear, where would you rate the most discomfort you've had in the last month? And that can be that can stink, basically.
Yeah, it's hard to manage. It's sometimes hard to get out of bed.
These are the things, I'm not sure why that screen is a little weird there, but these are the things that people tell me that really bother their back or their posture. It's the things you just got through talking about. Trying to work on things like your taxes, using your computer, driving, sitting. Sometimes it might involve using a cell phone. A lot of times people tell me things like vacuuming, bending, twisting, mopping, anything where over a countertop or a slight forward lean plus moving. Those are things that can really bother a back.
Yeah.
And I like to tell people it's not supposed to hurt. And I don't care how many people tell me, oh, it's my age, it's my arthritis, oh, I've got rheumatoid, oh, I've got this or that. Those are conditions that may make you more predisposed to having these problems, but none of those are reasons that mandate pain. You're not required to have pain just because you get older.
Even with the stenosis that you mentioned earlier?
Stenosis. Like I said, I'm doing a whole talk on it tomorrow.
Yeah, I can't wait to hear all the facts about that.
When we look at the human body, there is a natural aging process.
Yeah.
If you're not generally taking care of your body, parts of that can be uncomfortable. So you've got to understand what are those things that are happening and what are the steps I take so that they don't have to hurt. There's plenty of people who make it into their 80s and 90s that don't have pain. The reason we have pain is because we'll have a little injury or some stiffness or something goes on and we tend to stop. Like, oh, I've got to stop moving. Or how many times do you know someone who is older who you're like, oh, you just rest. We'll take care of the work. You've earned your rest kind of thing. Well, the body in motion stays in motion. Once you start resting, this is why so many people die within a couple of months of retirement, because they keep going and then they stop. The body needs movement to function. What do things to be thinking about? Age is just a number on your driver's license. It is not a pain sentence that you're supposed to have this for the rest of your life. So
that's good.
I have so many people who have just resigned themselves to a life of pain. They're like, oh, I have arthritis, I'm doomed. And they do nothing and they just suffer. But there's a lot of things you can do for this. We know this now. So let's talk about the biggest mistake that people make when it comes to their posture and things in their body that hurt. This is what they do. They ignore it.
Yeah.
It usually comes in the form of an excuse. I'm old. I've had this problem forever. I had a friend who had this problem and they still have problems, so there's nothing I can do. I don't have time to do this right now because I'm taking care of my family. I'm taking care of my job. I'm taking care of the yard. I just really don't want to know what the answer is because I'm afraid I might have to have surgery.
Mhm.
This usually comes in some form of an excuse. And I ask people, I'm like, so why are you just now getting around to fixing this if you've had the problem for 20 years? And usually they found a way to ignore it until a family member made them watch one of these talks. And there are things you can do about it. So instead of ignoring it, another option that some people pursue is to alter it. Unfortunately, this usually looks like addictive medications, painful injections, or expensive and often ineffective surgeries. That's kind of a sad state of affairs, but that is Western civilization. We have the greatest advances. We can cut you open and try to put things back together. But the human body is an amazing thing. And if you take care of it in the right way, most of the time, surgery is not the answer. And East Tennessee is one of the worst in the country. We have over 95 prescriptions per 100 residents written for opioid medications.
Wow.
It's a lot.
It
I mean,
is.
that's all but 5% of the state that just, here you go, here's a bottle of pills. And we know that it only takes 5 days, that 1 in 3 people taking opioid medications outside of a hospital system, more than 5 days of use, you have a 1 in 3 chance of becoming addicted.
I've heard those statistics. It's scary.
It is. And I usually do these classes. We have a whole, oh, here you go. There's a quick tour. We have a whole area up there that's specifically for, we have a whole conference room that's just for doing these talks. And when we have people come in, and we usually have about 15 people at a time, and we'll go through and teach about these different topics.
Mm-hmm.
I usually ask people, and I just show of hands, does anyone in this room know somebody who's been affected by opioid addiction? Okay. A bunch of people raise their hands, and then ask, does anyone in this room know somebody who's been affected by someone overdosing from opioids? And most hands stay up. It's really
That's sad.
like, it's not the scare, when you were a kid, you hear just say no, and you see this bad guy on the streets trying to like push you drugs. This isn't that. These are people in pain that are just trying to find a solution, and opioids are not it.
Yeah.
Injections can be effective for some things, but it's just for the symptoms. All it does is help with the inflammation. It doesn't change the reason you have the inflammation. So while it can be beneficial at times, it's never a solution, so to speak. So, are you game for medications, injections, and surgery? Handling it. And I think I'm going to change the way this is written, because a lot of people, instead of saying handle it, a lot of people just deal with it. That kind of falls in the ignore it phase. Like,
Yeah.
I can handle it. I'll just get by. When I say handle it, I mean like actually get a handle on it. What is the cause of your problem?
Mm-hmm.
A lot of people say, I have pain in this location, but not a lot of people know what the tissue is that's causing pain, why that tissue is under stress and causing pain.
Yeah.
What about my body that puts that tissue under stress that then causes pain? So we have to take these kind of play detective and follow the yellow brick road and find what is the source of your, and why is that source angry?
Mm-hmm.
So not just the pain, but we have to look at the cause of the pain and the reason that happened. Does that make sense?
Yeah.
A lot of times I see people in this ignore it phase or alter it phase where they will be like bailing water from the sinking boat. And it's like, nobody has said, stop, where's the leak? Let's plug it first and then fix it. And so many of these things that might benefit from just a little bit of rest, or maybe just enough of anti-inflammatory to help things settle down, or maybe just a small amount of therapy. If you don't address the underlying cause, I have some people who get surgery, and they have a beautiful new shoulder, but they didn't address the underlying cause and they just hurt it again.
Oh.
And that's expensive to be off work for 4 to 9 months, depending on what's going on with your shoulder, to have to go and do it again 6 months later and it's way more painful the second time. So that we see that happen with a lot of different problems where people just want the symptom to be better so they can go back to ignoring it.
Yeah. Get back to work. A lot of people have to do that. They don't have any choice.
And I have people, I can't tell you how many people, when I was first starting off, I thought, oh, this looks bad, they need surgery. And I've seen enough people over the years that just said, no, I can't afford to have the surgery. I can't take the time off because of my kids. I can't take the time off work. There's nobody to take care of my mom or my sister or whoever I'm helping out with. Or I own my own business. It would die. It would sink if I didn't take care of it.
Mm-hmm.
It's interesting that when you just follow the steps, guess what? They get better and they do well with things. But you have to do the right things, not just, time doesn't just do it for a lot of these conditions.
Mm-hmm.
So, what does successful, non-invasive, natural treatment look like? Hi, I'm your friendly neighborhood physical therapist. What does successful, non-invasive, natural treatment look like? It looks like physical therapy. Now, I will tell you what's been really interesting to me these last few weeks is I've got a couple of the therapists that work with me, and I've been asking patients, like, how's it going? Are you having a good experience? And the one thing that people constantly tell me, and I'm so surprised by this every time, they say, this is not like anything else I've done before. And to me, I feel like this is physical therapy. This is what it is. There are still some places out there that kind of have that herd them in, herd them out mentality where you say, here's your exercises, good luck. And in reality, that's not the ideal way to be treating our patients. There are some conditions where really all you need is exercise. But most of the people that I see, their problem came on over time and they need to get to those root causes of what happened. Or why did I blow out my back when all I did was feed the cat? It's just a little can of food. It's like that little bitty thing. It couldn't have been that bad. But finding those root causes is where we make a difference. So when people ask me what the most important part of my job is, it's this first thing, a thorough assessment. Okay? Remember all those credentials that we have? I've also got Randy working with me. He's got a lot of credentials. I've got Sam. She's working with me. She's got a whole background in kinesiology. We've got phenomenal skills right here in the clinic that we can lean on and pull from. So if we get something that's really weird, which guess what? We treat the things that other people can't get better. So sometimes we see the weird stuff, but we've got a lot of brains to come together and like, what exactly is going on here?
Mm-hmm.
What we look at, and the difference between just standard, here's some exercises, you fall in this category, so here's how you're supposed to go forward, and being thorough is if you're very precise at finding what the cause of the problem is, you don't have to do like 8 weeks of physical therapy 3 times a week with doing a home program that takes you an hour every day.
Mm-hmm.
In reality, what we do is most of our patients spend about 4 minutes every day working on what they need to work on. If you're specific and precise, you don't have to treat everything. You just treat the things that are the problem, right?
Right.
And then as you get better, you kind of peel back those layers, and now it's like, okay, what's left? What do you need to know? But the more precise we can be, the more precisely we can track down the cause, the more precisely we can pursue the treatment. And unfortunately, I have a lot of people who get a diagnosis based on an X-ray or an MRI, and they tell me no one's ever laid a hand on them. Guess what? It would be great if I had like see-through vision, but the reality is that moment in time when they take a picture is just a moment in time. It's not showing the function of how you're moving. And if you're over the age of 35, we're gonna find problems from where you're starting to get wear and tear through the joints. And we have lots of people in baseball players, goodness, most all of the Major League Baseball pitchers have labral tears in their shoulders. They're still out there throwing a ball, 80 miles an hour. And but it's not stopping them. So just because you see a problem on an X-ray or MRI does not mean you're doomed for life or that it has to get fixed. The question is that problem what's actually causing your pain? Because a lot of times we'll see someone who has a little problem and their body scarred it down, healed over, and it did just fine, but it still looks bad on an X-ray or MRI. And then they come in and they have a completely different problem, but someone looks at an MRI and says, oh, that's what it is. And no one's ever tested it and said, let's test that tissue and ask the patient, hey, is this your pain? And the patient's like, nope, that doesn't hurt at all. Why would I have a whole surgery to fix it? It doesn't hurt. It's not bothering them. They're able to do what they want to do. And it cracks me up. I had a gentleman this last winter who he actually has a farm. So he's always on the farm, carrying heavy things, pushing, pulling, managing a tractor. He's doing all kinds of things. His MRI still shows that he has a complete tear of one of his rotator cuff muscles. Guess what? He came in, he said, I just can't afford to take the time off. Is there anything you can do? And guess what? We looked at it. He had one little thing wrong, and it was how he was holding his shoulder blade. It took 3 sessions to teach him what to do, and he hasn't had any problems with it.
Oh,
now,
that's great. Good success.
He was told because the MRI said, you have this full tear, you have to have it fixed if you want to use your arm again. Well, if in a week and a half he was able to, with no problem and no pain, he could carry what he wanted, did it matter what the MRI looked like? No, it didn't. But as a society, we tend to be heavily reliant on what does the X-ray say? What does the MRI say? Instead of actually getting our hands onto the tissues, testing it specifically, because we can test specifically each one of those little tissues and see which one is your problem. And once we know which one is your problem, we can be very specific in how we target it. So I think, and I know I spent a lot of time talking about that, but the most important part of any treatment regimen, whether it's PT or anything else, is that you have an accurate assessment of the problem.
Yeah, I agree with that.
So this is where we like to mention, you got to have someone get their hands on you and actually feel the tissues. Now, in this time of COVID, we have a lot of times where I'll have people, we'll just do a video visit like this, and we'll be able to watch how they move, and we can get about 85% of where we need to be just from an online visit, which not as good as, the 95 to 100%, like, okay, this is the problem, we can feel it, we can see it, here's what's going on. But it does get us on the right path until you are able to get in for some hands-on assessment. And I have a lot of people who, guess what, 85% better means no pain. They can do most everything they want to do. So a lot of people are happy with that. But I want to get in and get my hands on it. And this actually says shoulder because I copied some of these slides from my shoulder workshop. But whether it's the shoulder or the spine, if you can get in and get those joints moving and get them moving in the correct direction, it helps with the lubrication, helps reduce pain, helps improve function, and allows you to move in ways you want to that don't have to hurt. So once you have that thorough assessment, then guess what? It's not hard to get your hands on and work exactly on the tissue that needs it. And you don't have to do 500 different things that hurt. You do the one specific thing in an comfortable position, and people get better very quickly. And finally, stabilizing and strengthening exercises. Do you notice I'm a physical therapist and I just said exercise last?
Yeah.
It really, I tell people one day lightning's going to strike me for saying this, but you don't have to exercise your way better. If you've got bad posture and you do all this exercise to get better, all you're doing is getting stronger at your bad posture. All you're doing is getting stronger at being bad. So once you correct things, then we teach you how to move, how to strengthen or stabilize, how to use your body so it functions for you in your world. And ultimately, that's what matters. Not, hey, I did all these strengthening exercises, and I can't tell you how many people come to me and they're like, oh, you know what? I found these exercises for my problem. So the doctor said I had a rotator cuff tear. I went on Google. It said, here's the exercises you do. And I did them. And I hurt really bad now. It's like, oh, you just did more damage because you weren't doing them correctly. You just didn't have the capability to do them correctly because of your bad posture or not being able to get your head or spine in a position that was safe to do so. So those are It's not about doing things, it's about doing the right things. It's not even about doing the right things, it's about doing the right things correctly. It's not practice makes perfect, it's perfect practice makes perfect. So this is where you have to ask yourself, what are you going to do? Do you want to ignore it? Would you like some of the addictive medications, painful injections, or expensive and often ineffective surgeries? Or would you like to get to the root cause of your problem and actually get a handle on it? So,
Yeah, that's the direction I'm going.
you want to actually get a handle on what's going on. So here's what we look at next.